Next, we have Representative O'Neal offers amendment number 6 for House Bill, for the H1 substitute for House Bill 5784. Would you like to discuss your amendment?
Yes, sir. Thank you, Mr. Chair. My amendment would restore the funding for several public line items, including initiatives to reduce health disparities, gun violence prevention and reduction, healthy moms, healthy babies, and doula care. While I also commend, Mr. Chair, the chairperson for this committee and the vice chair for the congenial relationship that they have established, which led to just robust communication for the committee. But as it pertains to health disparities, Mr. Chair, COVID-19 put a glaring spotlight on the need to address health disparities that exist within communities of color. Challenges, for example, with infant mortality, pregnancy outcomes are very, very real. And despite uterine fibroids being a common condition that disproportionately affects Black women, and studies show that this issue is rarely discussed. According to studies, by age 35, about half Black women have had uterine fibroids, and by age 50, Mr. Chair, that number increases to 80%. These figures are higher for Black women than any other racial group. Finally, not to fund a study on gun injury, violence prevention, is borderline criminal, I would say, and that's a hard word. And I'm a pretty kind of modest kind of guy, but when you think about all the things that are going on, not to mention the Oxford tragedy that happened right here in Michigan, and the level of gun violence that exists and we see and hear about every day in our communities. The funding could help this state, this great state of Michigan, implement some real evidence-based initiatives that provide the data that could save lives and, most importantly, Mr. Chair, prevent another Oxford tragedy that happened, again, right here in the state of Michigan. This is an opportunity, I believe, to be a leader in each of these areas. And funding these line items, I believe, will allow us to do just that. I move my amendment, and I encourage my colleagues to support it. Thank you, Mr. Chair.